Yes, I'm Peter Dodd. I'm Solicitor Health Policy and Advocacy at PIAC, and I have with us here Sascha Callaghan, who's a lawyer and research scholar at the Centre for Values, Ethics, Law and Medicine at the Sydney University. And I've got Chris Ryan, who's a psychiatrist and also from the University of Sydney. Welcome. Sascha, there's been some recent changes in practice in terms of mental health law in New South Wales. Can you tell us what they are?
Sure. Well, up until recently, when a person was detained in hospital for treatment under the Mental Health Act, their detention in hospital would be reviewed within about a week of their of an order being given that they should stay in hospital. That has recently changed, and so now the Mental Health Tribunal will come and review that person's detention within 3 to 4 weeks of their going to hospital. So instead of a review by a magistrate that would happen within about a week, there's now going to be a review by the Mental Health Tribunal within about a month.
Yeah. Doesn't the law say it should be as soon as practicable?
Yes, it does, and that's one of the concerning things about these changes. It's worth noting that normally if a person is deprived of their liberty for any reason, say they've been put under arrest or for any other reason they've been deprived of their liberty, it's a long-standing rule and right at law that the terms of their detention should be reviewed by an independent person. So the same applied in the mental health context, and in that situation the law has been since the 50s that a person's detention must be reviewed by a magistrate or now by the Mental Health Tribunal as soon as practicable. There was a recent law change which put the Mental Health Tribunal in charge of conducting these reviews, whereas previously it had been the magistrate. The law wasn't changed in respect of the reviews having to happen as soon as practicable, but now that the Mental Health Tribunal is doing these reviews, they are unable to get to see patients until the 3rd or 4th week of detention. So you're right, the law hasn't changed. It does say that patients have to be seen as soon as practicable, but the Mental Health Tribunal has determined that as far as they're able to perform the review, that would be within 3 to 4 weeks.
Yeah. Chris, you've got experience as a psychiatrist in the New South Wales system. Some people say that the reason there's been these changes is because the hearings are stressful on patients. What do you say about that?
Look, that's not been in my experience at all. I suppose it is true to say that from time to time it can be stressful for patients, but generally speaking, in my experience, patients welcome the opportunity to have someone come to the hospital, an independent umpire if you like, and the opportunity to put their concerns to that umpire. Since these changes have come in, I think it's had quite a detrimental effect on the care of my patients because I'm no longer able to reassure them that the system is fair and responsive and somebody will be around soon to check that everything's been done in exactly the right way. It really sets up a sort of patient against doctor sort of process which really wasn't there under the old system, where review was automatic and very quick.
Okay. Is that your view, or is that the view also of your colleagues?
Oh, look, that's my view, but it's the view of many of my colleagues. We recently polled this, and just over a weekend, over 70 of my colleagues all wrote in to support that. And I think it's much more widely held than that. So
obviously there's a cause of concern about people's rights and also something with therapeutic benefits being taken away. What do we do now, Chris? What needs to happen now?
Well, look, I think that really efforts have to be made to change this. The best way of going about that, I'm not sure. I'm not a lawyer, but it seems to me that the law is written the right way. It says as soon as practicable. It just seems to me that 3 or 4 weeks can't be what the law meant.
Okay, Sascha, is it open to challenging legally?
Yeah, I mean, I would suggest that the question is whether as soon as practicable, which is what the legislation requires. The law says that reviews need to happen as soon as practicable, and I think there is an important legal question about whether 3 to 4 weeks is as soon as practicable, and that's the sort of thing that might be open to legal challenge.
Yes, and it could, and PIAC would certainly be interested in taking that further. Thank you very much, Sascha. Thank you very much, Chris.
Thanks, Peter.